We're seeing that the military has been doing health outreach operations since the very beginning of its establishment. But now what we're trying to do is we're trying to say, how is this tied into our national security objectives? So rather than doing a MedCap or a health outreach program where it's primarily focused on our internal training, what we're really trying to do is how are we doing this program in a way that will empower the local community and that will leave something that's sustainable long term. The other thing that with 3005 and the new directive 6016, military health support for stability operations, what we're trying to do is recognize that all of our activities are done within the framework of a larger civilian and not only U.S. government, but global effort to improve health security around the world. So I think really what we're seeing is we've been doing it before. Now what we're trying to do is we're trying to ensure that our efforts are standardized and within a context of Millennium Development Goals, Global Health Initiative, the larger frameworks that are going to make us all secure. I think the implication of 3005 for the military health community is it basically expands the interest and the area of operation that the military health community is involved in. Before 3005, in conventional operations, the military health system was primarily focused on force health protection and readiness. And so it was basically empowering or supporting the warfighter, ensuring that they're fit to fight and that once they're injured, they got first-class care. With the publication of 3005 and the new directive, 6016, military health support for stability operations, what Department of Defense is saying is that not only are we caring about the warfighter, but we're also caring about the host nation and the local population. And the military health system needs to expand its focus not only from force health protection, but to begin empowering the local public health system as well as caring for the local citizenry. And then the planning aspect is now instead of only looking at conventional combat operations, we're going from phase 0 before we ever even think about going to war, all the way to phase 5, the reconstruction and stabilization phase. So it's each phase rather than just phase 3, which used to be the primary focus during conventional operations.
Maybe there are some challenges on the level of Department of Defense. That issue of the importance of health maybe has to be evaluated more. Gregg has spoke about the 3000 and the 6000. 3000 instructions directive has mentioned how important it is to look to health and to engage health, and it led to the initiation of the 6000 directive instructions, which expand on that specific meaning of how to engage health and how to go into the details of how to do that on level of stability operation, all the details of the responsibilities, the requirements, the service level commitments to that. So within the Department of Defense, maybe it's the approach now is to more evaluate health and stability operation. And other third level challenges is domestically, maybe that is within the United States government itself, that there has to be more engagement of more cooperation and collaboration between the civilian side and the military side, which is very important, so that when we are engaged in some countries, we'll be following one policy or one way to approach to that important issue.
It's even go beyond medical community. It goes beyond to all agencies engaging outside the United States. I can give you an example, the Center for Disaster and Humanitarian Assistance Medicine, where we work at. It's a multi-million-dollar agency, and it's part of the Uniformed Services University. And we're one project on that center. And if you go and see what others are doing, they're outside the country almost all the time. They're engaging all nations, Africa, Asia, South America, and they're developing more and more projects, and they are efficient right now, but we expect them to be much more efficient after we end up our own project which is identifying language and culture skill needs for health engagements, and that would purify and improve the quality of the products provided, and they come back and tell us always what they saw, what they feel, and so we have the local people around us in the United States telling us what they need, and we can work on this.
We have a medical say that every patient is a disease. We heard that say since we were in the medical school. And later on, when we have our experience in the medical and in being a physicians, we knew that advice was really right. My point is that there are no one model and there are no one standards things that we can follow to say this is a conflict and that's how we will deal with that conflict to get good results. In order to get that full idea, definitely we'll need to engage whoever and whatever organization, how much their small size they have, and share small amount of interest or whatever in that big picture. Because that big picture, everybody is holding a piece of it, and in order for us to see that whole picture, definitely we have to share everybody, and that's why all the NGOs and all the civil, governmental, non-governmental organizations has to share in such meetings and in such gatherings.
We're at a point where so many things are changing, and what we're trying to do, and we're lucky PKSOI is bringing together all the subject matter experts and people from the field to capture best practices, because, for example, the Uniformed Services University of the Health Sciences, they're training the future military medical leaders who are going to care for those who are going in harm's way. What we need to be doing is taking the lessons learned from the field and incorporating them back into that curriculum so that when they graduate, they're ready to operate effectively in a stability operations environment. We're in a brand new situation. PKSOI is taking the lead, but the academic institutions, whether that's the service academies, whether that's the war colleges, whether that's USUHS with the medical students, all of these military students need to be adjusting what they're studying, what they're learning to be ready for the wars that we're going to be fighting in the future.